There are so many things that need to be considered in order to safely deliver eye health care during the pandemic. For the Orbis teams on the ground and for our partner hospitals, this has meant reconfiguring spaces to accommodate physical distancing, adding barriers to equipment, adopting mask protocols, and procuring additional personal protective equipment, among a host of other adjustments. In addition, we've had to adapt to the new ways people are managing their eye health. Are they skipping needed treatments? Are they hesitant to take part in training programs? How can we help with this? These are the challenges our staff and volunteers are managing as they do their best to ensure everyone is protected from this virus while continuing to try and save sight. I'm Dr. Hunter Cherwick, Vice President of Clinical Services at Orbis International and your host today for SIGHTLINES. Orbis is an international, not-for-profit organization working to end avoidable blindness and vision loss around the world. In this episode, I'll be talking to a number of people who are helping to ensure critical eye care continues safely despite the coronavirus. First, I'll be welcoming Dr. Rishi Raj Borah, the Country Director for Orbis India, and Dr. Umang Mathur, the Executive Director at Shroff's Charity Eye Hospital in Delhi. Dr. Mathur is an expert in systems management. In fact, he recently partnered with Orbis to deliver an online lecture for clinicians and administrators on the topic of systems management post-COVID lockdown. It's a great lecture, and the recording is available for free online for anyone who's interested. You can find it at cybersight.org. During this episode, you'll hear the term slit lamp. That's the microscope that doctors use to examine your eyes, the one you put your chin in when you go to see the eye doctor. And now let's get into it. Here's my conversation with Dr. Rishi Raj Borah and Dr. Umang Mathur. Rishi Borah is with us. He is the Country Director for Orbis India. Rishi, maybe you can talk a little bit about yourself, where you're from, and the team you lead as part of Orbis India.
Basically, I'm from Assam, one of the northeastern part of India. Currently staying in Delhi and then leading a group of 20 colleagues in Delhi office and planning and implementation of Orbis mission and vision India, Nepal and Indonesia. Our basic work in India is around children's eye care. So we started in 20 years back and we have been supporting our partner institutions across India. I think probably we have supported the world's largest children's eye care network with 33 partners across 17 states. And these partners have been providing eye care services for 1 million children they reach out to every year. And then similar kind of network we have established in Nepal, which is also, Nepal is a small country. We have about 8 centers established there to have a kind of national level network for providing children's eye care across Nepal.
Assam, where you're from, is one of the most beautiful states in India. It has the greenest tea plantations I've ever seen in my life. Assam is such a beautiful place. Dr. Umang Mathur is with us. He is a cornea specialist, and I'd like for him to talk a little bit about his background and the work and the team that he is leading.
Thank you, Hunter, and thank you, Orbis, for giving me this opportunity. I'm Dr. Umang Mathur. I'm the Executive Director at the Dr. Shroff's Charity Eye Hospital, New Delhi. Dr. Shroff's is over 100 years old hospital based in the heart of Delhi in a heritage building. Our association with Orbis has been for over almost 20 years. We were fortunate to be the first land-based project of Orbis with its focus on pediatric ophthalmology. And with Orbis, we have not only grown as a children's eye care institution. Initially, our faculty was trained at some of the best institutes in the world, and with a lot of hospital-based teaching programs that happened with the help of Orbis' support. Now we are training ophthalmologists, pediatric ophthalmologists, optometrists, orthoptists, nurses, anesthesiologists to spread good children's eye care across India as well as in countries like Indonesia, Vietnam, Nepal, Mongolia, to name a few.
Dr. Mathur, you recently gave a CyberSight webinar on how COVID is impacting your practice, your hospital, your team, and how you all are adapting to make sure you still allow patients to receive quality care. Maybe you could talk a little bit more about the points you raised in that CyberSight webinar and how you and your team are adapting to the COVID crisis to be able to continue the great training, the great quality care that you provide.
So COVID was something new to all of us. We weren't quite ready. So India had a pretty strict lockdown initially, and that was a good thing because we got time to learn. We got time to establish systems. So initially, we worked a lot on rearranging our clinics, in changing patient flows. Fortunately, although we are in this very crowded place in New Delhi, we have 5 acres of land. So we just opened up a lot of gates and reworked with the patient flows so that there's more social distancing. Having established a lot of those systems, we were feeling quite secure with us, ourselves when we were seeing patients. There were shields that were put on slit lamps. All the staff had gloves and masks and caps and gowns and PPEs. And we had to create some barriers for at registration desks. And all those things we worked because we thought initially it was the patient who's going to bring COVID into the hospital. Actually, what happened was that, yes, we did all that right, but we realized it wasn't the patients, it was our own employees who were a bigger risk because they were coming from areas and their families where they probably had contracted COVID. And there was a time in early May when 63 of our employees had to be quarantined. And that was difficult because you had to handle them emotionally as well as, there was a lot of scare at that time. And so we again rearranged and we said, let's work smartly. So we established some triaging clinics where they were quick clinics to just look at things like conjunctivitis or surface allergies. Didn't require a whole lot of workup. We said, you come back later, we'll just give you what is required for now. And with that, about 1/4 of the patients were checked out, while those who had more, needed further examination were brought into the clinics. So we regulated traffic. Instead of starting all the ORs at one time because the workload was definitely lower, we said, okay, let the doctors come in 2 shifts so that we have less staff coming. So instead of opening 5 ORs, we said, okay, let's work with 3 so that we don't have to call all the OR staff. So by reducing staff and whoever was there was kept busier, that they didn't get time enough to go and chat together or to eat lunch together and have coffee together, because those were the things we always, feel that our own people are safe and our guards come down. But I think the important thing was to create this awareness that you are at risk with your fellow employees as well. And that took some time for people to adjust to. But having established that for the last about 6 weeks, we've not had a single person in the hospital who needed to be quarantined or had to be, or tested positive.
Rishi, I definitely want to hear about, the work you're leading and why eye care and the programs and the team you lead are so critical during this pandemic.
We had a lot of school eye health programs. Now, during this period, all the schools are closed. And you don't know whether the schools are going to be open when and then in what form. So whatever strategy with partner we have developed to reach out to kids going to the school, now probably that strategy is not going to work out. Or the current situation also will not allow the school authority to give you a permission to conduct this kind of activities within the school. So everything what was planned now have to relook at. There is a challenge, but it creates a lot of opportunity to look at what we had not done earlier. Now, small thing like when we go to the school now, what we are thinking that now first we are going to teach the child how to do a proper hand washing. Earlier we haven't done it. If we would have added this particular hand washing, hand hygiene and personal hygiene things along with school eye health, probably many of the little health problems in the rural school like diarrhea and all this would have been little prevented, which is beneficial for a child as a whole, not only eyes, as a whole, as a health of the child. But in the hospitals also, as Dr. Umang said, different hospital, they're developing protocols, they're developing guidelines to deal with this new normal. There are many of the hospitals are also trying to figure out how to deal with this particular situation in their own setup. Develop a self-assessment tool out of this particular guideline so that anybody, any institution can use that guideline and then see that where they are and then what are the areas that needs to be improved upon in order to deal with this new normal.
No, thank you so much, Rishi. And obviously, I'm so proud of the team and the work that you lead. Dr. Umang, obviously, Rishi has talked about the concept of the new normal. What does that mean to you and your team as we're going through this COVID tunnel? How do you inspire your team? What vision do you provide to give people clarity on what is your new normal for eye care, both during and post-COVID?
It can get pretty morbid with this COVID, and all you hear on the television is how the numbers are rising. And so you need to keep the whole team together, focused, and you still have to go on. I mean, going to a hospital, seeing patients can be a little risky. But we've been fortunate that despite all these problems, our team is pretty well motivated, coming every day and enthusiastically. And over a period of time, I think people have got more confident that we have a safe environment and it's okay to see these patients. I see it almost like maybe what HIV did to operation rooms and how it established norms as universal protection. In the operation room, that you consider every patient as HIV positive. So I think overall you've become safer. Overall, I think it will help in getting better systems in place. I would go back to your previous question also. I mean, why it's so important that eye care should remain in focus. Because of poor access and the scare, patients have stayed at home and not coming to clinics for getting basic treatment. And so it's very important that we bring this awareness out that it's important not to ignore your other ailments during this time. And the focus on eye care is very important. I think it also highlights this fact that we need better training, that comprehensive doctors who are readily accessible in areas where, patients live in villages or smaller towns, they should be able to handle certain level of what we today call as subspecialty. It's important. You can't have specialists in every small nook and corner. You need to have better trained ophthalmologists who can handle smaller emergencies, some bit of glaucoma, some bit of cornea, some bit of retina. It doesn't need a specialist to handle these cases. And so I think it'll be very important to establish better training systems, short programs. And here again, I think technology can help, that we can have smaller courses which are online. You don't have to close your clinic and come for 3 months for training. Can we do that on a weekend hands-on course? The rest of it, can it be established through online courses? So I think COVID should be taken as an opportunity to, do better training of doctors through technology. Primary care becomes very important. Vision centers are back almost 80% of their workflows than what it was in the pre-COVID era, because they are accessible. People find them safe. They can reach to a vision center. So needs to be a shift in having good quality paramedic training that can do some primary work closer to where the patients live. Again, technology needs to be brought in where through tele-ophthalmology from a vision center, can you connect to a doctor either in a secondary center or a tertiary care system? I think those are rudimentary right now, but I think we need to give that more focus on primary care, focus on technology, to help in connecting patients to the right people, creating that referral network, and better training, I would say, of comprehensive ophthalmologists so that they can look after patients closer to home.
I think you said so many important things for our listeners and viewers to know. So much of blindness could be prevented. And as you said, late presentation, whether it be an infection like a corneal ulcer or even an ocular cancer, an eye cancer like retinoblastoma, prevention and early recognition and treatment is key. And as you rightly said, people are now hesitant to travel to the super subspecialists like you because of the distance from the communities. You talked about the vision centers, that these are in the local communities, primary eye care that is high quality, readily available, and they're almost back to pre-COVID numbers. Maybe you could just talk about the importance of vision centers and how those have really become pillars in the community, not just for eye care, but we're actually now doing COVID training about hand washing,
Yes.
signs and symptoms to report in that. Maybe you can talk about vision centers and how that's so important to your strategic plans and the rural outreach that you do.
About 5 years back, we established a school for training young women, and we focused on women. They are 12th grade pass outs who are trained as eye care paramedics. So they belong to the local community, and over a period of about 2 years, but essentially within about 9 to 12 months, they are trained well enough to do refractions, to do a basic slit lamp examination, do a pressure check, to identify common diseases, and they know when to refer. We are able to look after patients closer to where they live. They can readily access them. These vision centers open every day as primary care clinics, and they do comprehensive examination. It is not just a torchlight examination. They do a full examination for the patient, and they have become, like you said, the pillars of our community work. And we right now have about 35 vision centers in our system, and this year we're going to open another 20. Already, even during this COVID period, the vision centers have become the most important place for referrals of patients, both for surgery and for medical treatment. So it's a very important link with the patients at the grassroots level.
You all are obviously leading that way, and it's so impressive to see the quality at every level of Shroff's care, whether it be in the operating room, in the clinic, or now, in the community with the vision centers. I definitely want to thank you both, not only for taking the time today to talk about the incredible work that you and your teams lead, but also inspiring us and having us think about what does the new normal look like for all of us as we go through this COVID tunnel. So thank you so much for your time and expertise. That was Dr. Rishi Raj Borah and Dr. Umang Mathur. Many thanks to both of them for coming on the show. My next guests are Dr. Rahul Ali and Dr. Munir Ahmed. We'll start with Rahul. Rahul, maybe you can tell us a little bit about yourself.
Hi, everybody. I'm Rahul Ali. I'm an ophthalmologist by training. Done my master's in public health and MBA from Johns Hopkins.
Thank you so much for being here. And Munir, thank you for joining us this evening. Where are you at the moment? And can you tell us your role at Orbis?
Thank you very much. I'm actually now in Dhaka, in Bangladesh, responsible for country office, country program in Bangladesh. And my background, I'm basically public health management specialist.
I want you to take a minute and talk a little bit about your country. I've been there many times for work, and I leave always appreciating a new layer of complexity and the diversity that's in your country, the people, the cultures, the languages, the nature. Maybe you can tell us a little bit about your country first, the eye problems that you're addressing there, and the great work that you lead.
Bangladesh is a densely populated country, has a 60 million population. And 70% of these population are living in the rural, remote areas. Actually, 1/3 of the country is inundated during the flood situation. So there are natural disasters. There are a lot of situations where the people are actually suffering.
No, you're right. I mean, if you ask me one adjective to describe the population of people that I've met in Bangladesh, it's resilient. And as we're going to talk about later, the country has done an amazing job of treating the displaced persons or refugees from Myanmar who are there, the Rohingya population. And certainly you all face unbelievable challenges. As you said, you have extreme population density. For those in the United States, Bangladesh is about the size of Wisconsin and has about half the population of the United States. and much of that is on a floodplain.
The child population in Bangladesh is 64 million, which is very important for us, as an eye health organization. And what you can see, there is tremendous improvement in child survival rates. There are 400,000 premature babies are born, and we know now that at least 35% of these premature babies are at risk of retinopathy of prematurity. So this is an important issue. On the other hand, there is a life expectancy has been increasing, and that's why the degenerative diseases are also growing. So the cataract is also increasing. We can see that there are 6 million people are suffering from refractive error, and 1.5 million are actually now they need glasses. So this is very critical for us actually to think about.
For those who don't know, refractive error means that you need to wear glasses. You can see that all three of us have refractive error, and it's a growing problem in Asia and something that Orbis is addressing in schools as well as communities. Now, I'm going to move a bit to Rahul, and I want Rahul to talk about how he has worked not only in India, but also in Nepal to treat refractive error and eye diseases in remote areas, and how he's done this now even more difficult or more challenged by the COVID crisis. How is he overcoming both the difficulties of distance and the difficulties of COVID? Rahul?
Eye health, high-end eye health is available in India. If there's anything being done anywhere in the world, there'll be somebody in the country who is doing it. Technology, techniques, research, all the way up to the top. I mean, world-class facilities available in the country. Yet, if you go out to rural India, you will find elderly people with bilaterally blind from cataract because they haven't had access to care. You will see children with very, very advanced stages of retinoblastoma. That's an eye cancer. And I won't describe what that looks like, but it's not a pleasant sight. But the thing is, there are still so many people who are below the poverty line, who don't have the means, who don't have the access, and need help. And that is what we try to do over there, help the people who can't get it themselves. So during this time of the pandemic, this has become an even more important issue for us. How exactly do you go out there and provide services during your outreach activities? And you mentioned the example of REACH, that's refractive error among children, our innovative school eye health program in India and Nepal. Well, just to give you some idea of the scale we're talking about, in the last 3 years, we conducted more than 5 million screenings for school children across India through the REACH program. And I can't emphasize enough how much there is a need to continue these services. The problem is not solved by giving a child a pair of glasses the first time we see them. That child needs an annual checkup and support year on year. And there are so many more children who are in need of similar care. So what we're trying to do is take the challenges the pandemic has thrown our way and use it to innovate in the way we continue to deliver our work and deliver our program in the areas we're working in. And at the same time, to also make our work relevant to the current needs of the community. So first and foremost, we must ensure safety of the children we serve, as well as the safety of our partners and their teams who go out to provide these services. And this will require the use of appropriate PPE, hygiene measures, ensuring safe social distancing, and adhering to all other recommended guidelines applicable to our work. We're also looking to see how we can provide these services to small groups of children and how we can leverage technology such as photo screeners to assess the refractive state or the power of a child's eye and do it accurately while minimizing physical contact. One thing which has really helped us is when we were planning phase 2 of the REACH programs, we were already centering our work around vision centers. Now, I'll just stop and explain what a vision center is. Well, a vision center is usually a fixed facility, about 2 rooms in a rural community or an underserviced area. And it basically provides basic primary eye care services, which consist of a comprehensive eye exam and refraction and provision of glasses, and identification of all other eye issues or eye health problems, and referral to a secondary facility or a bigger eye hospital. Now, by planning our REACH program around the vision centers, and that has held us in really good stead in this time of the pandemic, because the vision center is very easily accessible and conveniently located. So any school kid, a girl or a boy, and definitely for girls, they can access this anytime without needing to travel all the way into town. And to make sure that we're addressing current needs, we've embedded basic COVID education into our work when we visit schools now. For example, just simple things like basic knowledge about COVID-19, how it's transmitted, what you need to be wary of, good hand washing and hygiene practices, how to wear masks, maybe even how to make your own masks with cloth. So we're really trying to wrap everything around, and I guess only time will tell as we move our way through this pandemic what other challenges we're going to face.
That was excellent, Rahul. Thank you so much for talking about our vision centers. Munir, maybe you can talk about the Bangladesh experience with vision centers and how important these are for primary and community eye health in your regions with your partners and the communities that you serve.
In Bangladesh, actually, we have been implementing with our 23 partners. There are 27 vision centers actually we have been supporting. But interestingly, these partners also established 67 vision centers of their own, which itself says that the importance of this, because the community acceptance and community utilization has been increased significantly. That's why the partners are actually trying to establish these vision centers, because it is linking the community with the eye health. The vision centers just opened 1 month ago, and now we can see almost 100% patients are coming to the vision center. Whereas at the hospital, in the tertiary or the secondary level hospital, we can see 50% routine cases have been started. So you can just see that the comparison of the vision center, how it is being given importance by the communities. So I think this community level, the vision center is playing a greater role now than before.
No, and again, I mean, you all both have talked about how these vision centers are not just providing eye care, but they're really becoming resources in these communities for now the COVID training and COVID crisis.
In Bangladesh, actually, in general, I would say that COVID has given us sort of a scope to see and evaluate ourselves, that how our health systems is working. We are a part of the whole community and society. So COVID has given us an opportunity to rethink, to reshape, and to redesign our projects and programs.
I fully agree with you. I think one of the things I have always commented on about your team is their resilience and their innovation. And you've always been able to find opportunities to improve our work, find new ways and new approaches to do our work during a crisis. And I definitely owe you a thank you for allowing me to come and work with you and your team and see the work firsthand in the refugee camps in Cox's Bazar with the Rohingya population. And I didn't really tell anyone this, but while I was there, I was walking with you and seeing the incredible work you lead, that you're doing, giving glasses and doing eye exams in some of the most challenged and stressed environments in the world. And you're doing it with research and computers and excellent eye care professionals that you bring in every day. And for about 30 seconds, I don't think anyone saw me. I took off my glasses and tried to walk around the camp just to get a feel for what it must be like for our patients who have had to leave their homes, cross a very difficult border, and they're now in a camp and don't even have something as simple as a pair of glasses. And after about 30 seconds, I think for the first time, realized the power of the work that you do in the refugee camp and the incredible gift and power you give the people who have lost their glasses, never were given glasses, or doing the surgeries. I think one of the things I'd just like to take a few minutes, if you could talk about all the incredible work you've done in the refugee camps to help the displaced persons. If you could talk about how you do everything from finding eyeglasses for people who need them to taking people and children out of the camp to go get more complex surgery. As we all know, children, when they have their eye surgery, need general anesthesia. They need to be put asleep so that the doctor can do the surgery. And obviously that's not possible in a refugee camp. And I would like you to talk about all the things you've done, because for me, until I saw it firsthand, I had no idea the power and the impact you're having with that population.
Thank you, Hunter. That's a great opportunity for me to share our experience in that, because the camps there are a lot of sort of barriers to bring the people from the camps to the to Cox's Bazar in the eye hospital. So we actually set up this vision center at that level. And then we set up these outreach centers. Also, we have utilized the child-friendly schools in order to, do the primary eye examination at that level, just like, vision test and referring them to the vision center, for glasses. We have seen that there are 30 children, they cannot see, somehow they are blind. So what we have seen that they need to be, immediately transferred. And our partner hospital in the Cox's Bazar, they don't have that capacity. They don't have their facility. So what we have seen, we have actually trained and built the capacity of our tertiary center in Chittagong, the Chittagong Eye Infirmary Hospital. It has got a lot of energy to put into that, And I would say this has been a tremendous sort of effort going on and still going on. And now in a COVID situation, now transporting from Rohingya camp is an important issue. The transport, there's a restriction of movement of the transport. So you can't get transport all the time. So we are waiting for the reopening and restriction, limitation, removal of this restriction. And we are actually in consultation with partners to reopen the activities in a way with what we have been doing. So that will be a new normal.
Yeah. And, I think you said something very important. You always see the opportunity during the crisis, whether it's a refugee crisis, a COVID crisis. You and your team always find an opportunity to make sure eye care is prioritized, that we find new, innovative ways to do the best training, the best patient care. I mean, just all the levels of permission you need to secure to take a child from a refugee camp to an outside hospital to get the necessary surgery is incredible. That is a labor of love, and thank you so much for that work, Munir. That was Dr. Munir Ahmed and Dr. Rahul Ali. Thank you for joining me for Sightlines today. I hope you'll join us for the next episode and for the entire series. If you'd like to learn more about Orbis and the Flying Eye Hospital, please visit us at orbis.org. If you enjoyed this show, please subscribe to our YouTube channel to watch each episode and check out many other videos about our work around the globe. If you're listening to the podcast version of the show, please hit subscribe so you don't miss a future episode. And if you're listening in an Apple podcast, please consider rating or reviewing the show. It really does help others learn about us, about Orbis, and our sight-saving mission. Until next time.